My name is Rico Nice, and I am one of the instructional design team for the Academy of Peer Services, and also the coordinator for the virtual community of practice. And I was thinking a little earlier about how long I've been doing this. I've been doing self-help peer support for around 20 years. And in that time, I've both led peer support groups and gone on to become one of the first in the VA hired as a peer specialist, and sort of followed that path all the way through to becoming at least the interim director of the International Association of Peer Supporters. But I'm very happy to be back here in my home state of New York and really working with the peers here in New York, and especially looking at how we grow this workforce of peer specialists. And supervision, of course, is one of the key and most important pieces of what makes that whole workforce work. So it is my distinct pleasure to introduce Jonathan Edwards, Gita Enders, and Yumi as the first of the supervisors who will be part of our Ask the Supervisors series. The reason we asked these three wonderful supervisors to kick off this series is because they were among the key subject matter experts for the first courses in the supervision track we did in the Academy. So with that, I will begin the introductions with Jonathan.
Thank you so much, Rita, and it's good to be assured that we are recording. So good afternoon, everyone. My name is Jonathan Edwards, and I currently work as a program specialist for the New York City Department of Health and Mental Hygiene within the Bureau of Alcohol and Drug Use Prevention, Care, and Treatment. However, my previous experience had me as a supervisor of as many as 28 peer counselors at Kings County Hospital Center, working across 5 different service settings. I did that over the course of 4 years, in addition to other supervisory experience I had working with the peer workforce. So I'm very happy to be here today and to participate in this important discussion.
Thank you, Jonathan. And Gita?
Hi, everybody. This is Gita Enders. I'm the Consumer Affairs Coordinator for the Office of Behavioral Health at NYC Health and Hospitals. I've been supervising peers for about 7 years. Right now, I have in our shop here, about 15, and also providing technical assistance and support to about 50 peers scattered around our acute care facilities.
Thanks, Gita. And Yumi.
Hi there. So I am the director of the Office of Rehabilitation at the Bureau of Mental Health, also at the New York City Department of Health and Mental Hygiene. And my office oversees about 85 rehabilitation programs, which are span the gamut from peer self-help programs to peer advocacy, peer bridger, clubhouses, supported employment, crisis respite. And many of these programs employ peer specialists and provide peer support. I was also on the provider side as the Deputy Director of Howie the Harp Peer Specialist Training Center, and was also the Program Manager for the Academy of Peer Services before I joined the city. So have a varied and different experience with peer specialists.
Thank you, Yumi. And just to get us started, I have asked Jonathan to give a really brief definition of supervision and 5 functions of supervision that he finds particularly helpful in helping to categorize the work that the supervisors do. Jonathan?
Okay, thanks again, Rita. So supervision is something that we're finding many people working in our field may not be doing regularly, and sometimes that results from a lack of understanding what supervision really is. It's more than just mere oversight or coming into someone's office and giving them marching orders for the day, but rather it's a structured relationship with the goal to help the supervisee gain attitudes, skills, and knowledge needed to be a responsible and effective worker. And that's across the board. It's also rooted in the development of social work and casework, and this is demonstrated in the concern for the needs of participants or people who are being served. And it's so important to mention that in peer services, in our literature, there's nothing specific to the supervision of peer specialists. So we do need to, or we have looked at other fields and we borrowed from those fields. And I think it's important to first establish a good working definition of supervision that's universal before we move into sort of how we would nuance that practice to meet the needs of people who are re-entering the world at work. And lastly, and most importantly, is supervision encompasses 5 different functions, and I've identified those as administrative, supportive, educative, advocacy, and evaluative. And just to give a very brief snapshot of each one of those functions, when we talk about administrative supervision, we're talking about processes ranging from the recruitment and hiring to helping an employee understand and adhere to policies and procedures. It has also to do with, understanding time and leave, and some of sort of the more content related matter pieces of the job. The supportive aspect has a lot to do with helping the employee to build rapport. It really has to do with utilizing a strengths-based approach, promoting wellness and self-care in the environment. We're not just talking about peers. I think this is general good practice. We'll move on to the educative function. That has a lot to do with providing training, coaching, and context for the work and understanding the environment in which that work is being done. The advocacy domain has a lot to do with building morale, once again, strengthening the peer support discipline and helping employees to understand resources that are available to them. It's a very important domain which Yumi, who is here on the webinar as well, and I added to what was originally the 4 functions of supervision because we realized that there was a big piece missing. So we added that about 2 years ago. And lastly, but certainly not least, is the evaluative component, which is not only, but has a lot to do with conducting performance evaluations, helping to manage expectations, and providing feedback for the work. So these are just very basic snapshots of each of those functions. And I know that very shortly we're going to hear from someone else on the call about administrative supervision. So thank you.
I just want to add one thing in terms of advocacy that's come up recently that's very important is the advocacy of supervisors to help with the advancement opportunities of peer specialists.
Thank you.
Yeah, thank you, Yumi. So before we launch into the main question that we're going to be answering for today's Ask the Supervisor session, I know somebody else just joined, and I just wanted to mention that we're moving into having each one of our panelists ask this one question, answer this one question, and then we'll open the phone lines up for questions and answers. So if you're not on mute right now, if you could just put yourself on mute until we're done with the first 3 presentations, and then we'll go ahead and open the phone lines up for questions and answers. And I think somebody else just joined. So once again, we're just moving into the first question, which we're going to have each of the panelists answer themselves. And then once we're done with the 3 panelists answering this question, then we'll open up for questions and answers related to their presentations. Thank you for joining us. And I'm going to go first to Gita. And just backing up to what Jonathan was saying about the 5 critical functions of supervision: administrate, support, educate, advocate, and evaluate. I believe your answer was going to answer some of that. Sorry, go ahead.
So yes, the administrative function of supervision. I do a lot more of that than I would like to do, but that's because I'm pleased to say that we are standing up new peer services, what seems like every day here at H&H. And so this involves a lot of recruiting, interviewing, and hiring of new peers. Now, when I say new peers, we hire people with experience, but we're always open to people with training, for example, Howie the Harp training, who only have maybe a few months internship. Some people have long work histories that predate their interest in peer employment, but many peers come to the table with a very small background in prior work. So ideally, what we like to do in supervision is case presentation and role play around peer, the peer part of the peer work. Now, I hold weekly group supervisions for each cohort of peers that I supervise, along with individual supervision as needed. And I don't mean that as needed for disciplinary reasons, but as needed to just talk individually with someone unburdened by the pressure of the group. But what I'm finding now that I'm taking on larger numbers of peers and reaching into the venue where people have not had a lot of work experience, there's a lot of administrative content that has to be dealt with, be it dress codes, time and leave, computer literacy, and all of these things seem secondary to the work we're all there to do, which is support individuals as they make their way through the psychiatric or substance use disorder systems. But these things have to be taken care of, especially because the last thing we want is for employers, in our case, hospitals and clinics, to say, oh, sure, he didn't wear a belt today, but you know, he's a peer. So we don't ever want that kind. We don't want a lot of lateness and absence, but this takes a lot of coaching, again, for people who do not have a lot of experience in the mainstream workforce. But it's worth doing because we're all about success, personal and professional development. And I find, at least for me, if coaching is done in a mutually respectful and honest way, that peers are not unhappy to hear suggestions for improvements ranging from clean fingernails to taking your hat off in a meeting room. So I would close by saying that the challenge for me is not that the peers are underemployed or underexperienced. The challenge for me is that I enjoy doing a lot of the value-added supervision and not so much always administrative and performance evaluations. So I'll leave it at that.
Thanks, Gita. Yeah, there's the fun parts of supervision and the not so fun parts of supervision. Okay, so Yumi, I'll ask you the same question. What, in your view, is the greatest challenge facing supervisors today? And I'll put myself on mute.
So in my own work experience and from different supervisors of the various programs that we fund, there seems to be, and I think it's both, not only on the peer specialist side, but also on the supervisor side, and being unclear about what exactly is reasonable workplace accommodation. And so I want to first start off with the definition. And reasonable workplace accommodation is considered to be any accommodation that's given to a employee with a disability that doesn't provide undue hardship to the employer. And typically that would be something that might cost great sums of money in order to provide the accommodation. And at the same time, though, the person must be able to complete the responsibilities of the job even with the reasonable accommodation. So, you know, people tend to be cloudy about, well, reasonable accommodation means I get to pick and choose what I can and can't do, and have to be sort of given compensation for not being able to do certain things, and which is not the case. And so there isn't a listing or finite listing of reasonable accommodations or definitions, but because it really depends on the individual and the context of both the employee and the employer's situation. So just to give an example, what reasonable accommodations could be is the assistance to maybe make some changes to the aspect of a position or the workplace setting itself that will enable the employee who has the disability to do his or her job despite having that disability. So under the ADA, employers are required to provide reasonable accommodations to qualified employees, and you must show clear documentation and justification for needing those accommodations. Again, unless doing that, providing that reasonable accommodation would pose an undue hardship. So in terms of requesting reasonable accommodations, I mean, there's no like exact time frame for processing a request or providing the accommodation, but generally the time frame should be as soon as possible, okay? And what that means is after the approval is you know, authorized, then it should happen quickly. So one of the things that could be done is to restructure a job. So that includes modifying, so let's say reallocating or redistributing like minor job functions that an employee is unable to perform because of a disability. So it could be that some of our folks, and I'm a consumer myself, you know, if we take certain meds that make us drowsy in the morning, so let's say a responsibility is running, facilitating groups in the morning, what could be done is to have a staff member who facilitates groups in the afternoons, who can, you know, has not a problem with doing them in the morning. You switch their times in terms of responsibility. So the work is getting done. It's just that you're making the accommodation for somebody's needs that are affected by their disability. The other thing is you could do something about altering the functions, or let's say the essential tasks that are need to be performed. So if someone has concentration issues, we might have to allow more time for the submission of reports or inputting progress notes. And that's something that could be accommodated, you know, to the point that the deadlines are met. But it's not required for the employer to allocate the essential job functions and to provide reasonable accommodations, but to do so if if the employer is able to and wishes to do so. The other point that has come up a lot is the issue of medical leave, particularly when we have a setback in our mental health conditions, and the permission to take medical leave. And oftentimes folks don't understand that you have to first use your accrued paid leave or take unpaid leave. That's typical of any workplace, even if you had a physical health disability and needed to take medical leave. So an employer also doesn't have to provide paid leave beyond, what any other employee would get. Employers should allow people with disabilities to exhaust completely their accrued leave first, and then to use the unpaid leave. So if, for example, a person gets 10 days of paid leave, and they have an employee who needs 15 days, the employer should allow the individual to use the 10 days of paid leave first, and then the option of taking unpaid leave. And, there are several issues in terms of the types of leave. I mean, it could be for obtaining psychiatric or substance use treatment that people have to take some time off for, or recuperating from an illness or an episodic manifestation of the disability. But in those cases, an employer cannot apply a no-fault leave policy by which employees are automatically terminated after they've been on leave for a certain period. If there has been agreement that a person is able to take the leave, there has to be an agreement on when the peer specialist will return to the job. And there have been situations where it hasn't been absolutely clear and written down, and both the employer and the employee has a responsibility to make sure that the documentation of the agreement is in place. So the last question people ask is, does the employer have to hold the position, open as a reasonable accommodation? And for a certain time, most employers will have that policy for an employee that's granted the leave, that's entitled to the position, unless the employer can demonstrate that holding that position is going to, again, impose an undue hardship. And say there's a contract that needs to be completed where X number of groups need to be facilitated, and you absolutely have to have somebody hired to complete those contract commitments, that would be considered a hardship for the employer. So these are some of the issues that both employer, supervisors, and peer specialists struggle with in terms of getting some clarity on these issues. Okay, so that's it for me.
Super, thank you, Yumi. And I'll have some questions to come back to you with in a moment, but I'd like to go on to Jonathan and ask the same question. So what is, in your view, the greatest challenge facing supervisors today?
Thank you again, Rita, and I just want to sort of give a shout out to both of my colleagues here on the phone to really, I guess, downsize the breadth of information in each of their respective areas to talk about it so eloquently on the call. I know that Yumi could have gone on for a long time, and we, would still want to know more about reasonable accommodation, and also Gita with the administrative supervision piece. I know that I struggle with that a lot, supervising a large cadre of peers and feeling very frustrated when I had to look at the 28 performance evaluations and see which ones would do first. So I have great appreciation for all that. But in terms of the question for me, I would say that the most challenging situation facing supervisors today has a lot to do with how I began on the webinar today, is talking about defining supervision and understanding the role of support and advocacy without conducting therapy or infantilizing or pathologizing the individual for challenges or situations that she or he may be going through. Fortunately, Rita threw out a little phrase, or just reminded me of something called doing the dance. And if I forget what to say in the next few minutes, I can always go back to say, it's all about doing the dance between being supportive and also, understanding the role of some therapeutic dynamics without conducting therapy with the person. For example, all employees at one point or another are going to present with the need for some support, whether it's around a massive workload, work-related stress, personal issues, which we always say, leave those at the door, but the reality is we can't always compartmentalize. And, I'd say that one of the best recipes for conducting supervision is to really try to help the person focus on not so much what's going on, but how it's impacting the work. Maybe partializing the situation so that the person may be able to take some measures to, support themselves with the guidance of the supervisor. For example, making sure that they're managing their time, that they're taking a lunch period. It may not always be realistic for the person to take a full hour, but to make sure, they really should be doing that, but the reality is that many of us don't do that. Not great examples, but people need to take breaks, and they need to self-care. And one of the things that I want to emphasize is that these practices are really good across the board, whether you're working with peers or non-peers. Gita and I are also licensed as social workers, and we know that, in that particular field that people oftentimes struggle with large caseloads and boundaries and, feelings around clients or participants and wanting to help perhaps more than the hours that they allow you to. So I think a lot of supervision is about helping the person to, understand the work, understand how to do the work in an effective and an efficient way, and to also to self-care. I also wanted to talk a little bit about the role of the supervisor in really helping other staff to understand what the peer's role is, and to use stigmatizing situations as teaching moments. For example, when I was a supervisor, once in a while, and I don't want to call out any particular discipline, but let's just say that someone from nursing might have come over to me and said, Mr. So-and-so had a lot to say in the team meeting today. He really has a need to talk a lot. I think there are some personality issues there. And I would say, well, can you tell me more about that? Because, the culture might have been that they didn't want staff to talk in general, but I really didn't let those things pass. I didn't let statements like that be made without trying to provide a little education around the fact that, a person being outspoken is not necessarily because they're a peer. It's probably because they like their work, they feel very invested in the team, they feel they have something to offer, and maybe, appropriate coaching might be around managing the time that a person uses to make points in meetings, but not to shut the person down. The other thing that would happen is sometimes some of my staff would hear other staff making comments about them, about things that they thought were symptoms or just the way that folks were showing up at work. And so I would use supervision as an opportunity to ask the person to unpack it, to sort of talk about more of what happened. Because sometimes people can present with a piece of the situation and say, well, so-and-so looked at me funny. And then when you unpack it, you find out that that person was stressed out and their look may have had nothing to do with you. And of course, this is an oversimplification and I'm sort of making this up, but it's really important to look at the entire situation and not just, you know, a piece of the information. To give support without making someone feel like you're taking care of them, to express regard and concern for a person without labeling what they might be going through are some of the other aspects of, you know, conducting good supervision, but being careful not to move into this zone of where you're actually doing therapy. I just want to share very quickly one of the teaching moments for me where I was, you know, the student. I attended a conference in Long Island, and it was the International Interdisciplinary Conference on Clinical Supervision. And there was a guru there, I think his name was Alex Gitterman, and he was sort of doing scenarios and using the audience members to kind of act out a supervision session. So of course, you know, I volunteered and I was the supervisor who wanted to be welcoming and provide a supportive environment, and I would listen to what people had to say, and before I would know it, the supervision session was over and I allowed the person to ramble, and I really did not give them any feedback on their work. So this was early on in my supervision career, and so I felt it best for me to sort of be truthful about my limitations, and I got some really good feedback. And what I was told is, you know, if you're meeting with a person for an hour, you know, perhaps allow them the first few minutes to vent or do whatever they're going to do, but as a supervisor, it's your responsibility to redirect the person to the work, and even how, you know, what they're bringing to the table might be impacting that work, and to help the person to feel empowered to do certain things to make them a better employee, even if it's giving them an article to read or doing role play, sometimes holding group supervision. There's a exercise that we use calling pair and share, where you pair people off in a group supervision and allow them to share about their interactions with someone that they were supporting. So there's many different ways of sort of redirecting and sort of handing the ball back to the person and not solving the issue or the problem for them, but being there as a guidepost for them. So it can be a very rewarding experience if you can get past the administrative pieces and you're not asking people to fill out a lot of forms or to do their annual mandatory exam for the hospital, or to really have to go over time and leave procedures for the 50th time. If you don't have to do those things, then hopefully you'll be able to use a few minutes in that supervision session to really drill down on some of the work issues that can be really, really rich when we find that we can help a person through our own lens of lived experience. Thank you.
Wonderful, Jonathan. Thank you. So what I'd like to do is just open up the phone lines now. If you've got yourself on mute, go ahead and come off mute if you have a question to ask. And you can ask any one of our panelists a question based on what they said, or you could also sort of comment on what your thought is on the greatest challenge facing supervisors today, and we'll have them, you know, possibly answer and maybe start even start a discussion. So anybody?
Hi, Rita. This is Damien DePau. How are you?
Hi, how are you?
I'm good. I'm good. I'm sorry I tuned in a little late. I was one of those people that you said I heard just somebody else tune in. But, you know, I wanted to answer this question as well because I don't know the background of Yumi or Gita. Jonathan, I think he works in a state position. But I work in a peer-run organization, and it's a nonprofit organization. So I wanted to answer this from my perspective because I think it's something that a lot of people in my position are seeing as well. And what I think my biggest challenge has been in being a supervisor is being an advocate, working in the field, and having you know, different committees and different meetings and different webinars and, you know, different things to be involved in, while at the same time managing an actual program. So, you know, I always want to be available to my staff, and I always want to be able to give them feedback and guide them and, you know, be here on a daily basis for the day-to-day work that we do. But it's tough when we, you know, go to a variety of different committee meetings and subcommittees and, you know, conferences and trainings and so on and so forth. So I think, you know, that's a major challenge that we're all facing. And you know, it's to be, for those of us who have a direct program that we're running, you know, to be, to have a seat at the table and be involved in these other initiatives, and while at the same time being there for your staff and actually making sure that you're, you know, that the people that you're serving are getting the best care, that, you know, the people that you're supervising have the best guidance and so on and so forth. So I guess it's just a time thing, you know, and from my perspective, that's been one of the biggest challenges that I've seen over the years.
Thank you, Damien. That was good. And I think that's probably universal. I don't think it's just peer-run organizations. I think every supervisor faces the time crunch of what are the priorities that I have to do to help my staff figure out what their priorities are, and it just keeps going. So thank you. Anyone else?
You know, recently we had, this is Yumi, Jonathan and I were involved in a symposium that we led for working peer specialists and their supervisors to discuss various aspects of the peer support workforce and challenges, including, you know, hiring and the supervision. And one of the things that is challenging, as Jonathan mentioned before, is how do you prep the organization that is primarily has non-peer staff for, you know, especially if you're bringing on a peer staff for the first time, how do you become that liaison, that ambassador in a situation like that? And oftentimes what happens is the employer has not prepared well for bringing on a peer specialist, and to educate the other staff, particularly if they're working on an ACT team, or Jonathan, you've had situations where maybe they're working in the emergency CPEP kind of program, and they really, a lot of those licensed professionals have never worked with peers before and don't understand the value and the benefit and how best to utilize peer specialists. So, you know, Jonathan, maybe I'd like to ask you what your experience was, if you had a lot of experience in a hospital with that.
So as Yumi mentioned, you know, the organizational readiness piece is very critical, and that could be anything from, you know, prior to bringing peers on board, is to actually have peers come to the hospital and talk about peer services and talk about how they may look. In the case with Kings County, you know, we had a subject matter expert come to the hospital who had done a lot of work with, you know, crisis services, and was able, and, you know, who also identifies as a peer, but he also runs an agency, and so was serving in the role of consultant. And as we all know, that consultants usually have a lot of credibility. So sometimes using a consultant to come in and talk about, you know, organizational change, and to talk about some of the components, and to actually honor the resistance and ambivalence that people oftentimes feel. So I think part of it is not necessarily trying to brainwash people, but to present something new, but to also kind of honor how they've been doing things, or at least doing things that are, you know, above board and decent. And it's also important to make sure that there's clear job descriptions, whether the person's working in the emergency room, inpatient services, outpatient services, the primary care clinic, and not just having the good job description, but making sure that everyone from the supervisor to the employee to the team members that this person is going to be working with understands. I think that there should be transparency with job descriptions, and peers should understand what nurses and social workers do, and they need to understand what peers do, because that's part of the problem, is that if I don't know what this person does, I'm probably going to either deliberately or inadvertently co-opt them or exploit them, you know. So one example in the emergency room is that it wasn't just the you know, person-to-person intervention, if you will, that would take place, but you know, people are usually coming into an emergency room in a crisis and hungry and tired, and sometimes they haven't had an opportunity to have a shower. So, you know, any staff member being able to engage that person and to help them with some basic human needs is an asset. And so it's not all up to the peer, but at least the peer might understand to say, hey, are you hungry? You know, would you like to get a shower? And to get the person, you know, fresh linens, but that wouldn't mean that the peer's job is just to do that. I would always emphasize the importance of teamwork and also performing a duty that would lead to the well-being of the person that you're serving. And I would always sort of get them to frame it in that context, to see that, yeah, well, you got someone a sandwich, but that might have been the best way you could have engaged the person at that moment. Maybe they didn't want to talk. So what good would sort of an individual engagement do if the person doesn't want to talk? But you can ask them if they're hungry. You can sit with them. You can let them know that you understand. You can share a little piece of your experience without bombarding them with your personal experience. And it's really just a way of being present.
Excellent. Thanks for that back and forth. Gita, did you have anything to add to that?
No, Jonathan really covered all bases. I would just reemphasize it's particularly important to take time, if possible, before standing up services to meet with all of the disciplines involved. And as Jonathan said, make sure that everyone knows what everyone does. Because just a little funny moment, co-optation works both ways, I have discovered. In the inpatient service, for example, sometimes the peers want to become very aggressive with housing assistance, and they will find a program for someone that social work has already found out is not appropriate, or the patient, the individual, sorry about that, a little hospital lingo, that the individual was not suited for or could not be admitted to or had been rejected from that week. So the peer, I mean, I'm talking about preaching to the converted. The peer should be treated as one of the team, as an important member of the team. And this goes back to what Jonathan said before, if the peer is perceived as doing something, speaking loudly, because they are a peer, it's a constant, as a supervisor, it's just a constant, I don't want to call it a struggle, it's the constant joy of education. So that's really all I wanted to throw in.
I love that.
You know, this is Yumi. I actually have a question for Gita, and I'm not sure if Gita's experienced this at the hospital, but lately I've also heard that, and it's been going on for a while in different situations, but that, you know, a lot of staff that are already there, and they may be social workers, typically, who fear actually that peer specialists are doing their job, and that may not be as much of an issue as that they are, I hate to say cheaper labor, but that they are more, the peer specialists are less costly for doing the same work, let's say case management. Maybe they even do it better than the social worker, and they have a fear of losing their jobs. And I hear this more recently in adult home situations. So I'm wondering, Gita, if you've seen this situation at the hospital, where there are a lot of union workers too, who could kick up a fuss as well.
You know, it's interesting. I actually saw more of this when I was working in nonprofits in Arizona 10 years ago. And part of that may be because we have such strong title protection in our unions here at the hospitals. I always have I'm always finding the opposite problem at our facilities because we have such strong labor relations negotiation. Our peer counselors, which is the corporate title, pretty much once they're in level 2 can be paid as much as a level 1 or level 2 social worker. So there's no cheap labor factor operating at H&H at all. Where we get into trouble sometimes, I may be repeating myself, is where the peer wants to help, and that is a laudable ambition. But so the peer wants to do case management or do social work or so this is why I say cooptation works both ways, because I haven't heard so much of that fear at the hospital, but I think that's also because of the way personnel lines are opened. No one is closing any social work lines and replacing them with peer lines. When we need peers, we add lines for them. So everyone has their own job. But, you know, like Rita, I've been doing this for about 20 years, and I used to hear this a lot more, but I don't know if that's because it was new 20 years ago and people were more ensconced and frightened of peers. I'm not sure if it's because of the length of time that transpired or because of the situation I find myself in the public health system. Nobody's making $1 million, but everybody's being paid pretty equitably.
Thank you. And I just wanted to go back to our audience and see if there were any other questions or comments on the question of the day of what is the greatest challenge facing supervisors. Oh, I had myself muted there. I'm going to go back to a couple of the questions that I jotted down back when you were all first talking at the beginning. And Yumi, I had just a couple questions that talked about when there is a need for reasonable accommodation and somebody is just being hired into a position, when is the best time to disclose that they have a disability that might need a reasonable accommodation? And any of you can answer that, but I was going to start with Yumi.
So, you know, if the person chooses to disclose and really wants that accommodation, it should be done pretty quickly after the, you know, formal onboarding has been done and you've gotten sort of the lay of the land and you have clarified to you what exactly your job functions are and how the operations really work. And, you know, the peer specialist should take some time to really think about whether they are able to do the tasks without a reasonable accommodation. And if they feel they are, then obviously there's no need to bring it up. But if there is a red flag right away for the person, it is best for an employee, a peer specialist, to talk as soon as possible to give a heads up to the supervisor about what accommodations the person might need, and to really sit with the supervisor to think of different ways to tackle it. Because what happens is oftentimes the supervisor may feel like that was sort of like sprung on them on purpose, and here you are having hired a person and they're really not able to perform the job. So it's best to be honest as quickly as possible. It doesn't have to be at the, and it maybe isn't the best thing to do is to talk about it at your interview, even as you get to your second or third interview and it's getting close that you will get that position. That's something you really need to look at in terms of what exactly your job responsibilities are after you've been hired. So that's just my recommendation, what I see works best.
Yeah, I think it was you, Yumi, that talked a little bit about the responsibility of the employee as well as the responsibility of the employer. And there's that tipping point of employees have rights, but they also have responsibilities. And I think that was an important point that, you know, employees need to understand that they do have certain responsibilities, and employers will offer reasonable accommodations, but not to the degree that it's an undue hardship for the organization. So, you know, sometimes that's not well understood in this whole arena. Anyone else have anything to add for any of the presenters or in response to the question of the day? Well, I want to then thank our presenters, Jonathan Edwards, Gita Enders, and Yumi Ikuto. Is that how you pronounce your name?
Right, Ikuka.
For just giving us a wonderful session on supervision, some of the challenges that you've faced and the answers that you've come up with, or the ways that you've managed to do supervision. So I thank you for your time today, and I'll look forward to you on the next round. Thank you very much.
Thank you.
Thank you.
Oh, and I wanted to close with just one quote that I took away from today, and that is that supervision is about the constant joy of education. I agree. Thank you so much.